In today's video, we're talking cervical spine pain, aka neck pain. That's pain happening anywhere from just above the base of your neck here all the way to the base of your skull. So we're going to be using the menu in Pete Egoscue's book, Pain Free. This is the revised and updated second edition. And we're going to be looking at the menu he provides on page 221 of this book. Now let's go ahead and get into what exactly are the Ecises, that's short for easy size exercises, that we're doing in this menu. First is standing wall with block, then is short foot, static extension, hero's pose, sitting knee pillow squeezes, and finally air bench. So why do these exercises work for cervical or neck pain? Well, it's all about improving the position of the head from how so many people walk around today with slumped shoulders and a forward head, because what are we doing all the time? Tapping on our phones, right? So this menu is largely designed to correct that forward head position and some other positions throughout the hips and the feet, throughout the body, that are going to help relieve pain in the cervical spine or neck area. Standing wall with block is the first one, right? So as you can see in the video on the screen, when we're doing standing wall with block, we are really forcing all the major load-bearing joints of the body into one vertical plane. And we're also using the block to strengthen the adductors and get the adductors from being gait muscles into doing their normal job of moving the hips in and out. So that's the real goal of standing with block. Now, the next exercise is going to be short foot. And I know you're probably thinking, why the heck are we doing a foot exercise for our necks? Well, it's really surprising, but this has to do a lot with the myofascial system and what a lot of people like to call the superficial back line. Now, the superficial back line is a contiguous piece of myofascial tissue, meaning the stuff that's your, like the plantar fascia on the bottom of your foot, connects through the Achilles tendon into the gastroc muscles on the back of your thighs or back of your calves. Those connect to the hamstring muscles, the back of your thighs, which then connect and muscles, rector spinae, I believe they're called, all the way up through your back, all the way into your neck. And then you have a large piece of fascia going over your whole forehead that connects right here, just above your eyebrows. And believe it or not, that can be dissected in one single piece. So when we were dealing with strengthening the foot and improving how the foot works, we're actually changing how your body works all the way from the tips of your toes to the forehead here. It's a really amazing thing. Next, we're looking at static extension. Now, static extension is a really commonly used exercise in this book. It's in a lot of menus, and that's because static extension is great for repositioning the entire spine. You know, if the lumbar spine and thoracic spine are out of position, how can we possibly have our cervical spine in the right position, right? So after we've affected the fascia going all the way from the feet to the forehead here, we're now trying to work in the middle part, and we're trying to get that spine into a proper S-curve, and we are trying to get some strengthening in the hips, some strengthening in the shoulders, just get you standing up more straight. That's what static extension is going to help you do. Hero's pose is doing a lot of the same thing. When we're looking at hero's pose, we are going to be sitting back on our heels, right? So we are having our upper body stacked normally. So we are having the hips and the curve of the S-spine, or the S-curve of the spine, getting your shoulders above the hips and bring that head back. So this is really going to help stretch the quads and take out dysfunctions in the quads while reducing compensations in the upper body. And that's a really great thing about hero's pose. That's one of my favorite Ecises. I do it just between tons of different exercises I do, especially after static extension. I love rocking back onto my heels. And you know what? If you're having trouble with that, you can use a pillow or a block to assist you until you can get all the way back onto those heels. Next we have sitting knee pillow squeezes. Now sitting knee pillow squeezes is a great exercise for strengthening your adductors while reducing compensations in the upper body. And we're also, if you notice, maintaining that arch in the lower back. That is critical to this exercise. And we're doing that because we need to keep the shoulders stacked above the hips. And what do you also notice? The ears are directly above the shoulders. So we're doing more to correct that forward head posture that is often causing so much of that pain in your neck. And this is going to help get your hip flexors to stop doing the job of the adductors as well. So we're dealing with lots of dysfunctions and compensations all over the body here. Finally, we're looking at air bench, and air bench is a great exercise for strengthening the lower muscles, the big movers in the body, all the gait muscles. And what do you notice about the upper body? Again, we have the shoulders stacked above the hips, we have the ears stacked above the shoulders, and we're keeping the neck back. We are using the wall to correct the load-bearing joint positions and bring them into a vertical plane, a single vertical plane. And we are, again, working on getting rid of this forward head posture that we are so often stuck in these days with our phones and our computers and our tablets. It's just become a different kind of pandemic than the other one.